Diabetes is a global health burden. Its prevalence keeps rising worldwide, including South Asia, where figures are increasing at an alarming rate. In this context, Sri Lanka College of Endocrinologists has taken the initiative to launch the Clinical Practice Guidelines on Management of Diabetes.
You felt out of depth when you see patients with diabetes. Diabetes management could be a daunting task. Each patient brings a different challenge to each scenario. The best outcomes can be achieved by using a guideline-based, stepwise, systematic management in each of these scenarios. This could be difficult, but the SLCE's diabetes guidelines brings you summaries of these problems and how to manage them in each of these scenarios in a summarized, easy to understand manner. We have video series for you to watch in your leisure. Even the printed text is easy to understand and has lots of flowcharts, tables, and easy to read text for you to use them in your day-to-day practice. Why not use them?
The question arises why we want to have a separate guideline despite having many guidelines both internationally as well as in our regional countries as well. The financial resources as well as some of the factors of our patients are quite different to other patient population. The main aim of our guideline is to educate even at a very grassroots level so that we can improve the diabetic care of Sri Lanka.
This guideline outlines the diagnosis and classification of diabetes and illustrates the glucose management with a dedicated chapter on diabetes self-management and education. This also includes guidance on managing cardiovascular risk, microvascular complications, emergencies, and special circumstances like diabetes in older adults and in perioperative setting. The document concludes with the proposed model for diabetes care in Sri Lankan health system.
The reader-friendly question and answer format of this guideline enables the readers to find out the answers to exact questions they encounter in their day-to-day clinical practice. Further, the highlighted clinical practice points as well as clinical algorithms, diagrams, tables, and figures that appear throughout this guideline helps the readers to find out most important clinical points very easily.
Diabetes care can only be optimized through collaborative efforts of healthcare professionals at all levels. This guideline is aimed at streamlining the primary, secondary and tertiary care services for a coordinated delivery of preventive and curative care services for diabetic patients. Sri Lanka College of Endocrinologists is always committed to uplifting the diabetes care in the country. After a meticulous process, we officially launched the clinical guidelines on management of diabetes in 2022.
We believe that we are responsible as a college in providing leadership to streamline diabetes care in the country. The different facets which we have worked out will enhance the adaptability of the audience at the receiving end. The Sri Lanka College of Endocrinologists is striving towards enabling the country reach a state of excellence in diabetes care.
And there are several tests available for history of education.
You will see a single gene.
Type 1 diabetes is an exception.
Therefore, diabetes first the lifestyle intervention disease.
Diabetic kidney disease is something that occurs over a period of time.
The dose of your diabetes rate and
Patient preferences and needs as well as affordability.